Hey everyone, thanks for joining me. It's Nicole here with Our Children, Our Future, La Cloche Early On Child and Family Center, and thank you for joining me for Family Matters today. We are still in April, so we are going to be talking about dental or oral health again. And today we're going to be talking about infants, so infants 0 to about 6 months, and what are some things that you can do to help promote good tooth growth, and how to care for baby's mouth. So, did you know that you should be wiping your baby's gums at least twice a day with a damp cloth from the time they're born? It doesn't, you could be breastfeeding or bottle feeding with formula or bottle feeding with breast milk, but they still recommend wiping out your baby's gums with a damp cloth, just gently, just to make sure that that milk isn't sitting in their mouth, causing possible tooth decay. So that is something that I know a lot of people don't necessarily know or don't necessarily do. They think that we don't have to take care of our teeth until they come out, which isn't always 100% true. So here's some great tooth saving tips that I got right off of the the Canadian Dental Association website, and I'm going to put them in this slide as well so you can see them and share the link in the description. So things that will help save your baby's teeth are breastfeeding. Because of the way babies breastfeed, the nipple goes farther back into the mouth, and when they are sucking, doesn't give the chance for the milk to just sit in their mouths. It often will go right down their throat. Does it mean that if you're bottle feeding it's terrible? No, you just maybe need to be a little more vigilant about wiping out your baby's gums. Providing breastfed babies with vitamin D supplements. So unfortunately, we as humans, we do not have enough vitamin D in our systems, even as grown adults. And so if you are breastfeeding, you are supposed to offer your child a vitamin D supplement as well. However, if you are bottle feeding with formula, you do not need to do this as it's already combined into the formula, so you don't have to worry about that. Once baby's teeth start to come up, making sure that you brush them, finding an infant toothbrush, and just gently brushing those teeth every day, twice a day. Never giving a bottle at bedtime with milk in it. If you have to give them a bottle at bedtime, try and provide just water, as you don't want all that milk again to be sitting on their teeth or in their gums all night long, building up that extra bacteria. Avoid letting your child walk around with a sippy cup full of milk, or a bottle full of milk, because again, it's just time for the milk to pool and sit. So allow them to have their milk, do a quick wipe out, and that way it's not sitting in their mouth building bacteria. Try and wean your baby off of a bottle and onto a regular cup if you can by the ages of 12 to 14 months. Now this is pretty tricky to do. Sometimes babies are not that coordinated, so you're expecting a lot of messes. Switch to a sippy cup if you need to, but work on trying to get that open cup. Absolutely no juice, pop, or sweetened drinks that go into the bottle or sippy cup. If you absolutely want to give those to your children, make sure that you're using a regular open cup. Limit unsweetened juice to a half a cup a day and dilute it with water. Serve healthy food and drinks. Give water in between meals, and don't dip baby soother into sweet things. Use a teething ring instead of teething biscuits, because again, those teething biscuits often will contain a lot of sugar that just gets to sit on top of the baby's teeth. So these are things. Now, of course, some of these are geared to babies who are eating food or who are starting solids already, so that's about that 6-month range. So again, please use your own judgment in terms of what you're okay with and what your doctor has said that is okay. So again, I'm going to attach this pamphlet to the description and plug it into my slideshow here at the end so you can take a look at it and get some more information. So I hope that helps everybody, and we will see you next week for Family Matters.